Clinical case study of a patient having tuberculosis. Case study. And the scenario is a 27 years old female presents to the outpatient department with complaints of fever, cough, body malaise, shortness of breath for more than 2 weeks, which she attributes to a nagging cold. Initially, the cough was with white and greenish sputum. She states she fears this may be something worse after experiencing hemoptysis for the past 3 days. She also admits to waking up in the middle of the night, drenched in sweat for the past few days. On asking questions during history taking about the TB or tuberculosis, she said that she was diagnosed with tuberculosis at the age of 13 years and was treated. There are no other comorbid factors. Physical examination, general vital signs, and these include blood pressure that was 130 by 85 millimeter mercury, pulse 82, respiratory rate 20, temperature 37.9 degrees centigrade. Sign and symptoms: fever, cough with white and greenish sputum, body malaise, shortness of breath, night sweat, hemoptysis, neck and lymph nodes, few small 2 to 3 millimeter non-tender freely movable lymph nodes in the left anterior cervical and axial area. Chest inspection, respiratory rate 20 breaths per minute. Palpation, tactile fragmentus, configuration and expansion symmetrical, percussion, and the percussion is symmetrical bilaterally. Auscultation, and these all are the components of the examination of chest. Okay, then auscultation, crackle breathing, especially over the upper lobe of lungs. A few crackles are also noted at the left apex posteriorly. Other areas of examination were normal. Investigations, laboratory testing, and these include CBC, that is complete blood count, and the white blood cell WBC count, absolute neutrophil count, platelet count was significantly increased. ESR raised. What is ESR? It is erythroblastic sedimentation rate, and it is usually increased in any infection. Sputum for AFP smear, that was microscopic examination of sputum positive for acid-base bacilli. Laryngeal swab, positive for mycobacteria. Mantox tuberculin test, PPT, tuberculin 15 mm at 48 hours. Hefentine test, that was positive. Pleural fluid aspiration, positive for Mycobacterium tuberculosis. Actually, this is the bacteria that causes TB. Polymerase chain reaction, that is commonly known as PCR, detection of mycobacterial DNA in sputum. Needle biopsies, biopsy of pleura, lymph nodes and solid lesion within lung reveal granuloma. Interferon gamma release assay, that is IGRA, it was positive as well. Adenosine diaminase ADA, positive. Radiological investigations, it includes typically chest x-ray, and it tells, most commonly it tells everything and diagnoses whether the patient has TB or not. Bilateral upper lobe infiltrates with well-defined cavitating lesion of the left apex. Therapeutic test, Shamroth test and window sign, that is clubbing of nails, positive. And then there is modified Borg-Dyspnea scale. It consists of points from 0 to 10, and 0 means nothing at all, 0.5 just noticeable, 1 very slight, 2 slight, 3 moderate, 4 somewhat severe, 5 severe, 6, 7 typically indicate very severe, 8 9 very severe, and 10 indicates maximal infection. Okay, modified Borg Dyspnea scale, and she was scoring 4. And then differential diagnosis, we do the DD with bronchopneumonia, tuberculosis, sarcoidosis, bronchitis. And what is the diagnosis? Secondary tuberculosis. Management, there are different types of management, which include pharmacological management and physiotherapy management. Pharmacological management consists of 2 phases. Number 1, initial phase, it comprises of 2 months, and isoniazid along with pyridoxine. These are the medications that we give to the patient. Number 2, rifampicin, it is very common, ethambutol and pyrazinamide, and these are the medications of the initial phase. And then continuation phase, 4 months, it comprises of 4 months, and isoniazid along with pyridoxine and rifampicin is administered to the patient. Physical therapy management includes chest physiotherapy and deep breathing exercises, which includes diaphragmatic breathing, pursed lip breathing, and then huffing and coughing, postural drainage, and position. Upper lobe, what is the position in the upper lobe? And apical segments, the patient should sit upright, leaning slightly backward. And anterior segments, the patient should lie flat on his back with his arms relaxed to his side. The knees should be slightly flexed over a pillow. Posterior segments, the patient should lie on his left side and then turn 45 onto his face, resting against a pillow with another supporting his head. Both the knees should be slightly bent. Manual chest clearance technique, it includes percussion. It is a technique used in physiotherapy, and I hope you guys are already aware of it. Goals, there are 2 types of goals: short-term goals and long-term goals. Short-term goals include stabilize the patient, relieve symptoms, improve exercise tolerance. Long-term goals include reduce the risk to prevent the further worsening of TB, to improve quality of life. Nutrition, good source of protein like milk and milk products, pulses, nuts, soy, fish, and eggs are recommended. Pineapple juice is very effective in treating tuberculosis. Pineapple juice helps to reduce the mucus formation and provides faster recovery. Drink fresh juice of pineapple on daily basis. Fruits and vegetables like orange, mango, sweet pumpkin and carrots, guava, tomato, nuts and seeds are an excellent source of vitamin A, C and E. These foods must be included in the daily diet regime of a TB patient. Prognosis, it almost consists of 6 months. Majority of the patients with the diagnosis of TB have a good outcome. This is mainly because of effective treatment. Without treatment, mortality rate for tuberculosis is more than 50%. Home plan, take the prescribed medications regularly. Physical therapy, diaphragmatic and pursed lip breathing, huffing, coughing, aerobic exercises, daily walk for at least 30 minutes or cycling for at least 15 minutes. Patient education, this is very important. While coughing or sneezing, take steps to prevent the spread of TB. Wear face mask, cover your mouth and nose with a tissue. Put your used tissue in a closed bag and throw it away. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hands. If you start feeling well after a few weeks of treatment, do not stop taking medication. Otherwise, TB germs begin to grow again and you will remain sick much longer. Follow proper diet plan. Avoid caffeine, refined sugar. Regular checkups at the hospital at least monthly. Discharge plan. Follow all instructions properly, including medication, physiotherapy management, nutrition, and home exercises plan. Patient feedback. Extremely impressed and delighted with consultation. Very pleasant and helpful doctor. I felt well informed on the benefits and risks of the treatment. Very helpful, nice manner. And here are the references.